Good morning, good afternoon, or good evening, whenever you're watching, wherever you're watching from. This is In the Middle. My name is Mike, and alongside me, my co host and trusted friend and colleague, TJ. And also, we have Kyle. How's it going, fellas?
Going great, Mikey. How you doing today?
Fantastic. We got a really great show coming up here. It's a topic that I'm
You have been
very
excited about.
dude,
You're like so giddy.
dude.
Like the
I feel
past
I
week.
feel like a little schoolgirl. Like I don't know what to do with anything. I don't know what to do with my hands. But I don't know. I don't know. I don't know. I don't know. But the reason I'm so excited about this is because this is a topic that I've seen affect so many people within my community and in the world in general. And that's healthcare. Whether it's traditional, we're going to talk about our opinions on how we feel, whether it should be privatized or go to a universal healthcare system. But the first thing that we always want to do, as we always do, is our comments. We got a couple of good comments here. One of them from seems like he's a new regular to the commenting business here with us, Jeremy.
I love it. Thank you, Jeremy, for all your comments. You're really keeping a lot of these conversations going. So thank you, man.
And I want to personally thank you for trying your hardest to keep all the comments in one. I really appreciate that. You only broke it up 3 times, but it's okay. We'll
better
forgive
than
you.
10.
Better yet, baby steps. That's all we're asking here.
That is a 50% reduction right there.
Dude, we'll take it. We'll take it. TJ with his quick math skills. I love it.
Actually, I'm not even right. That's it's still like 70% actually reduction.
I'm glad that you caught that. All right. Anyway, Jeremy's question was, with things ever changing, when it comes to the sickness, should people really be expected to change their entire life around with every update by the CDC and WHO? To call people stupid for not falling in line with every suggestion is a bit ridiculous and condescending. And condescension, me fail English. That's on me. I have no idea how to say this word. And mockery won't change anyone's minds. I agree with you. Mocking anybody is just going to discourage them from listening to your point of view.
Exactly.
So that's why me and TJ don't mock each other. We may joke around and whatnot, but when it comes down to the nitty and gritty of discussing a topic, we listen to each other out and we give our opinions based on the feedback on the information that's given. But I feel that when there's a pandemic, which seems to be coming around once every 100 years or so, during a pandemic, yes, these are the people that we should be listening to. And whenever they make changes, yes, I feel that we should be listening to them. And the proof behind listening to these professionals or experts is look what's happening across the globe to these countries that are actually listening to their equivalents of the CDC or the WHO. Their new cases are Germany. We looked it up, me and TJ here. Germany had new cases, 412, looks like on July 14th, which is today's date. Italy had 114, and those are just new cases. The death rates have dropped tremendously. And all of this is because these countries like Italy and Germany, they took these things to do, like wearing masks, washing your hands. They took it very seriously, and they seen firsthand about how not following that is going to affect your whole country. So if you look around at these countries like Italy and Germany that are following, I'll even throw Japan out there, that are following these guidelines, they have very little new cases. And pandemics, I mean, heck, anything could happen. But pandemics don't seem to come around often enough for me to sit there and say, no, I'm going to rebel against the CDC who's looking after my well-being.
So I would like to step in for a quick sec, Mikey, if you don't mind. Is that I actually kind of see a little bit of what Jeremy is talking about. Me and you definitely say you definitely agree with. We shouldn't be making fun of each other. I think that is definitely something that ends up happening. We all seen it on Facebook all the time, where the moment you say something out there that contradicts anything, especially on the media scale, everyone comes out and attacks you, calls you stupid, calls you dumb. And that's always and me and you've had 101 conversations about this, is where I draw the line at. Like, I love conversation. Even if it's wrong, I want to hear, I want to understand it. I want to hear your opinion. I get it all the time. There's so many times where I get conversations with people like, oh, blah, blah, blah. You know, the same thing with with our last episode with the cloth mask, how they really don't help you. Funny enough, after we had the conversation with the cloth mask, Bill Nye did an episode on it, which is exactly what
I seen that.
He blew right through his shirt. I was like, that's the point. It's so true. There's certain things you got to be smart with what you're doing. And I was glad, but it's so funny because how many times I came out and I told people that putting a sock over your face is not as good as getting an actual real mask and going out there and actually purchasing the correct grade and equipment. Right. That I was just called stupid and dumb, or you don't know what the hell you're talking about. You're just foolish, and you're just a right-wing supporter. That I do agree with Jeremy on that portion, because information does change. We should always try to stay ahead of the curve. We should always try to get information. We also should also see. I mean, I saw you brought out countries out there. But then there's the other Sweden. Sweden's only at like 400 cases, and they never shut down. Here in the States, South Dakota never shut down, and they're at 60 people. Literally, South Dakota, their government went, no, we're not going to shut down our economy. We're not going to stop what we do. They're only at 60 cases. Wisconsin opened very early and premature. They just said, we're done. We're tired of this. They opened up like a week before, like I think the end of April, or maybe like the first week of May they opened up. Wisconsin's only at like 400 too. So I always brought that up to a lot of people. I'm like, we're so quick to go, what does media tell me? And this is now my mindset. And now I'm going to go after everybody who doesn't have my same mindset. And I think I hate that mentality. I'm not saying don't listen to the experts. They should help you out. But doing research and seeing other side of things, and listening to where other people are coming at, and seeing other countries and other people who have different voices of opinion, it sometimes help. Like, I think a lot of these countries or these states, they still practice the social distancing. They still wore the mask. But did they shut down and keep everybody quarantined for long? No, they kind of opened up the economy. They were like, hey, wash your hands, wipe your ass, don't cough in your neighbor's face, use Lysol, go out there, live your life, just practice better hygiene. And we have seen, like I said, in Sweden, we've seen in South Dakota, we've seen in Wisconsin, where these measures have seemed to work. And again, I believe a lot of the spikes that are happening here in America, even though media is refusing to speak on it, and a lot of people I know is refusing to speak on it, is the protesting. The protesting caused a major amount of these spikes to increase. So I guess that's kind of my point, is that I see Jeremy's point. It's hard to, every time media tells you to jump, people are now gotten to the habit of jumping. And instead of going, hey, why do we have to jump? Can't I skip? I'm a skipper. I like to skip. Can I skip instead of jump? No, you can't. The media said jump. You got to jump. And it's just like, whoa. So I see where Jeremy's saying.
Yeah, here's one thing that rings to my mind when you're mentioning these states. I believe you said North Dakota, Wisconsin, South Dakota, Wisconsin. These are not very dense places. These are
Wisconsin
very
is, but South Dakota isn't.
South Dakota, as far as I know, I've known those states to be pretty wide open. Now, I mean, okay, you go into a downtown.
Dakota's wide open, so that's what I'm saying. I admit with you, South Dakota, but Wisconsin, it's just like Chicago. I mean, they have their centralized city that is massive, like Milwaukee and Waukegan and all those places that are on top of each other, just like Chicago does. But then when you get out of Chicago City,
it's all spread out.
It's all spread out, and it's big. I mean, most cities, New York City, Mikey, you've lived there. If you go upstate New York, it's widespread. But obviously you have New York City, which is the big condensed population. So I would say Wisconsin still kind of falls in that mindset because they do have Milwaukee. They do have a major city that has a major airport. I would say not really Wisconsin, but go ahead. South Dakota, I do agree with.
Yeah. I mean, I guess I don't know enough about Wisconsin. When I went there, I mean, like you said, yeah, I flew into Milwaukee and I drove up to Green Bay, and there was just nothing but farms. So now you go into downtown.
Green Bay is nothing, man. Green Bay
Dude,
when I went to Green Bay, I was ready to be like in a major city. Green Bay is
nothing. It's
guys.
so awesome though. I loved Green Bay when I went, but we'll have to talk about my Green Bay trip. But anyway, I want to look into what you're saying, because to me, these states are very wide open, and I don't know exactly right off the hand of what exactly these states did. So I have to take your word for it. But I'm pretty sure that if you dug into it, and this is just going on assumption, I would assume that a majority of the people were wearing their masks. They were carrying, and I would say that if the numbers are low, because New York City was, and let's even use Europe as an example, in the major cities in Europe, it spread like a wildfire. They couldn't contain it as quickly as they found it. So the more dense of the area that you're in, the more susceptible you're going to be to be able to get that disease.
But it also, talking about the numbers, also when everyone has already got it, like New York City, me and you talked about this in the last episode, New York City has now low numbers, and does that attribute to it spread like a wildfire? So again, you look at Italy in the same boat, and I mean, we could go back and forth on this, a lot of information, but I think that's the whole point, Mikey, and I think that's, again, what Jeremy is saying, which is the conversation is not so black and white. When you really look into it and you really have conversations on both ends, and this is why we need to continue having open conversations, is that you'll see that there doesn't seem to be one boot fits all, one size fits all. We should have open discussion, and I think we should, allow each other to speak without criticizing.
For sure. I mean, I don't disagree with that, but as much as we could go on with coronavirus, again, we could probably do a whole nother episode on that. Moving on to the next question, and this was more of a joke thing that I just realized. I actually just remembered Jeremy throwing in there saying that I don't have to censor myself. Well, Jeremy, I know TJ likes to throw the F-bombs and whatnot.
I don't know what you guys are talking about.
He's welcome to do it. But if you know me, my comedy style is more of a Bob Hope, Three Stooges, Jim Carrey sort of a comedy. I don't need to curse as much. I do curse. I'm not going to say I'm an angel or anything, but I don't feel that I need to curse to make my points proven. I could do that strong enough with my expressions and my tone of voice.
And I'm a Richard Pryor motherfucker with Eddie Murphy.
So
my one F-bomb.
That's how you got this.
I'll try to censor myself. But,
no, you're not. Don't lie to us.
No.
But that's why, Jeremy.
But okay, so that seemed to be a good conversation. There's also a couple other conversations that happened off of there. But on episode 2 of the coronavirus, Val brought up a question saying, do you think we are going to use these guidelines from now on? Are we going to have to wear masks for flu as well as in the following years? So what we're doing today with the hype of the coronavirus, is this now going to be something that is part of our lives and is going to be moving forward? And and this is definitely going to be very political in my next comment, and this is the way I feel about it, and I'm going to get probably shot at after I say this.
My gun is loaded.
If Trump wins, the answer is yes. If Trump loses and we get a new president, you won't even hear about coronavirus or anything next year. I will guarantee you, once we get a Democratic president in there, media is going to try to sway and turn to try to make everything light and great, because now we're done with the Trump era. So everything afterwards is going to be a different tone. So that's my opinion on it. If we get a Democratic president, you guys can mark this down as this date, and we move forward, coronavirus next year, you won't even hear about it. It won't even become an effector. It won't even be in the media or the news. If Trump loses, though, if Trump wins, though, yes. Do I see that this is going to be something just like the Russian, investigation where we're going to continue hearing about it? Yes, I definitely do. I think this is going to be something that's going to be tagged onto his presidency as long as he's in office.
Well, I don't think that it's going to be a political matter like you're saying, because at the end of the day, first off, I don't know what news sources you've been watching or whatnot, but from what I see in the media, nobody's blaming Trump for this coronavirus. So it's not.
Do you watch the same media that we all do? Because
every
time I pop it on, I could give 20 headlines of Trump and coronavirus.
What you're missing is that they're not saying that he caused the coronavirus. They're talking about his mishandling of it, which is a topic that we'll be getting into some other point. But that's what they're talking about. It's got nothing to do with Trump being presidency. What they're attacking is the fact that he didn't do what needed to be done to keep us ahead of the curve, which is why we are in the current situation that we're in.
But here's the point, Mikey, is that, yes, he's the president of the United States, but he's not the only. This is what, especially in this day and age, where it just seems like the president does every single job on the planet and he gets everybody together. And again, we'll have this conversation.
Yeah.
But remember, to the start of all of this, when Trump wanted to shut down all traffic to China, Nancy Pelosi went there and claimed how much it wasn't a big deal. And Trump is just being a racist. And even Dr. Fauci, they had videos stating from the CDC, and we had this conversation in the last one, where, or not CDC, I'm sorry, the World Health Organization backing up Nancy Pelosi's statements. So if he would have taken action a month, because that was literally 1 month before it then got approved, and then they started shutting things down, would there have been a difference? And that's kind of the point that I'm making, is that everything seems, and it's part of his legacy, it's part of his thing, is that, we got to blame him. Dude, I don't just blame Trump on the actions. I blame every person in that White House, including the Senate, including the House, of what they're doing and what they're doing incorrectly. But everyone just blames him because obviously he's the face, he's the president. It's always got to be his fault. And I just don't think that is entirely accurate when there's proof that he did try to take action first, and then he was denied that action. So again, I know, Mikey, we're going to have a long conversation on that.
We're going to talk about that, and we'll go on to that another time. But
all right, thank you guys for the comments and the questions and stuff like that, and getting us into, wow, I think we probably spent 10, 20 minutes on just talking about comments right there, because they're good comments, though. But let's get into the show, what I know you've been very excited to talk about, Mikey.
Oh, yeah. I mean, this I feel is kind of, my bread and butter sort of thing. I guess we start off with, what's better? What's your opinion on universal health care compared to privatized health care? What do you think?
I'm sorry. I thought that was the question, and I cut it. Sorry. What do you think of it? You're right, Mikey. What do I think about it? I'm really torn on this, Mikey, and we're actually going to have a really big segment on this one, right? We're going to talk about it, me and you, and then we're actually going to have some guest part of the show, and we're going to talk about a Big Pharma, and we're going to lead to other things. But to be honest with you, I lead to privatize, only because there are certain things and certain examples that I've seen that privatizing certain aspects of healthcare seems to actually be very beneficial. But then I'm also on the side of, I understand there's certain maybe aspects that we can socialize, and there's certain things that I think we could make better for the American people. I just haven't seen a lot of evidence to support that mindset or that theory. And here's another thing, Mikey, on my feelings with it. It also has a lot to base on our government, not really other people's government. Because I know a lot of people go, well, we got the government here, and things seem to be working and blah, blah. Yeah, but that's a different type of government. That's a different type of mentality. I come from Boston. I come from Chicago. I've come from New York, where we have very corrupt politicians, government. Our system is corrupt. Our system is broken. And right now, can I see the benefits of other governments and other social programs? Yes. But do I see us as America adopting these programs in a broken system? I don't think I'm ever going to be comfortable with that. So that's kind of where I sit on all that, Mikey. So I'll definitely pass it back off to you. What do you think is the solution, or what do you think is better?
Well, strong feelings for me is based on universal health care. The reason being is because it's proven to work in other countries. And the beautiful thing about things being broken is you can fix it. And that you don't just leave something broken because it's broke. You go and you fix it.
With you. I'm not saying we leave America the way it is.
No.
I think we got to fix a lot of stuff with America before we give them more power. My fear is giving a corrupt system a lot of power when it's not working right now. And with the stuff that they're given right now, they can't seem to do the job right. So why am I going to give them more responsibilities?
Well, I mean, as far as skepticism on trust on your government, I would think that as a individual that served, you would have more trust in your government. Now, I'm not going to deny that people, are, not everybody in Congress or in the Senate or whatever doesn't try to fill their pockets. But I don't think that happens as much as I'm thinking whatever media you're following portrays. I'm not saying it don't exist. I'm not saying that at all. But with universal health care, it can be accepted. And in fact, it's been shown with Obamacare, which is not a perfect system. When it first got initiated, it was initiated to be step one of a long process that has now been diminished. But essentially what Obamacare did was it insured, I think it's 56% more of Americans that were not covered before. Trying to look up my information and notes. I got a lot of notes.
While you're looking up your information and notes, you brought that up before our conversation that we had, and I looked that up. And actually, I didn't see where that number came in because you said 50% more. I don't know if they got better coverage or they were better off. But when I saw the numbers went from 27 million uninsured down to 20 million, that was only a 7 million difference. So I think that was like my only, I guess, question where did you get 50% of America suddenly now has insurance? I could not find that info.
Okay, so in this that I have in my notes, there's a graph that shows
Give me a quick second. There's a massive spider on my wall. I got to kill. Hold on.
Rolling in 3, 2, 1. So with Obamacare, if you look at the statistics before Obamacare took into effect, in 1997, let's just start it there, which is as far back as I could get information on, the uninsured individuals, the uninsured population was 15.4% of people. In 2010, it actually peaked to 16% before then slowly dropping down to where then Obamacare came into effect. And in 2015, it dropped down to 9.1 and then slowly creeping up to a 9.5 in 2019. So what that has done is allowed more people to essentially be able to have access to healthcare who didn't have it before. And when they go to the ER, they don't have to worry about $1 million bill. They essentially have to pay whatever it is that the plan doesn't cover, which is based on, I think,
most of the time, like a $9 million bill. But yeah. But no, so I hear your point. I hear your statistics with Obamacare. And again, I guess it's a little bit of where I see a little bit of the failures of the U.S. healthcare system is a little bit of Obamacare, because I don't know. I have this big notion here that we're playing around with this socialized / privatized system, and it just screws over us, right? And it screws over the people who are putting money into the system, paying, because again, Obamacare was a lot of broken promises, right? It was like, oh, it's not going to change your rates. You get to keep your doctor. You get to keep your plan. Everything's going to be great. It's just going to have, everybody's pretty much going to have to be forced in to buy this, which is what's going to, balance everything out. And then when push comes to shove, we found out, obviously, rates did actually increase. Actually, the cost of Obamacare averagely per state, this is the average, was about 30%. Some states were higher, some states were lower of the overall cost of Obamacare over the years that it's been active. It's really risen up that much. So that hurt, right? That hurt us as society, as people, to have that higher cost, because a lot of us had great plans. I had a fantastic plan. I lost my plan because of Obamacare, and I got dumbed down to a smaller plan that actually everybody in the company pretty much did. So we had tiers. All the tiers got eliminated, and there's only one tier, which sucked for me because part of my salary was based on that, right? I was getting paid a certain amount because I was getting 100% coverage and the low deductible and blah, blah. So I was like, oh, that kind of balances out. I'll take my $5 raise with $20,000 worth of work, but I get really good healthcare and insurance, and I lost all of that, and I didn't have that. So now, not only, especially during this time when we're actually having an economic struggle, to throw that on top of the American people, extra costs, extra money, and I didn't see any benefits. And don't get me wrong, I do see universal benefits. I'm always a big person with the precondition. It was actually one of the reasons I voted for it. Remember, I was a Democrat. I voted for the whole Obamacare push to it. And then when it came out, it was everything that I didn't want. It gave more power to the hospitals and Big Pharma, which what we didn't want, right? We wanted more control because we didn't want to spend $50 on gloves. You shouldn't have to spend $50 on sterile gloves. The box costs $10, but we're spending $50 on the box. We were supposed to have these controls put into place with Obamacare. We were supposed to not feel like we're getting gouged. Now we're spending more money on a system. We are still getting gouged in the system. And I see very small benefits to this to Obamacare.
So the disadvantages of Obamacare that you're speaking of is due to privatization, which is the part of Obamacare that, in my opinion, needs to be done with. So first off,
well, that's what I was trying to say, where they kind of, it's that blend of social and privatization.
Yeah, and it can't be. And that's the thing, is it can't be a mixture of both. And this is the evidence of that. So here's the thing. So with you agreeing to that, then you should agree with universal health care. And this is why. Essentially, with universal health care, I always say Italy. Let's take Japan for an example. So you go to Japan. Now you got socialized medicine. Now you have a specific condition. They say, okay, you take that pill. Now people say, oh, well, I have to take the medication that they prescribe. Well, there's a reason for that. The reason for that is because it's been medically proven by their chamber or health organization group, whatever the equivalence is there in Japan, that committee, they essentially turn around and say, how is this drug going to be better than the one that's presented on the market currently? And if you can scientifically prove that it's more beneficial than what's currently out there, at that point, the Japanese government will turn around and say, okay, here you go. This is a better medication. We're no longer giving this. You're now giving that.
And I see, and I would hope they're doing it the proper way, but there is a documentary out there talking about Big Pharma and how it is a money business, where there are going to get certain, like government has contracts all the time that they pretty much sign up for certain things, certain aspects, certain stuff like that. And you're going to get a government who's going to buy into a pharmaceutical company who's going to provide a certain amount of health care for a certain amount of price. And that's what they're going to give you. And you could be like, well, we're going to go with the better choice. Government's never been that way. Government's always done what could do the job at the cheapest price. Yeah, that is literally government life.
EJ,
Like if
that's
you've ever worked
American
in the
government. That's
government,
United States government life. When you go to Europe, they're going to provide you with the best medication that's provided at that level.
That's technically not all true. When I did my investigation, when I did my investigation on a lot of the stuff of why people travel out of Europe to go look for other healthcare and other systems, is actually a program that you were talking about where apparently, like in Europe countries, and you brought this up, so it's not going to be like something like, oh, I thought about it first and I'm not going to, but I kind of was researching after you brought it up, which there are different levels of care in Europe. There is the standard care. There's other stuff that you can buy into. If you want the best of the stuff, you have to buy into the best of the stuff.
Right.
The other people, no, you're going to get. So a lot of people find that they actually, and one thing I've learned about the European system too, is that, which makes sense. Every country, even though it's the European nation, they fall under, every single country covers healthcare differently. And so you get people who will leave one country to go to another country, to go to another country, to get this care, and then they get reimbursed back. And then, you know, and if you don't have your card, then you're up shit's creek. And there are other options where people tend to leave to try to find better care and better insurance. But there is that, there seems to be some type of tier program there.
Yeah, that tier program is essentially what's going to buy you better healthcare, which is exactly what I'm saying, and it sounds like you're saying as well. But as far as people going to other areas for like different medical reasons, I'm sorry, that's happening here too. So that's not a difference. I mean, I know people that had to go have heart surgery and need to go to Stanford because the doctors there are better for that particular surgery than they are. So that aspect that you're speaking of, I'm sure, is an aspect of where maybe Germany has a better lung doctor than Milan, Italy, or maybe Spain, maybe Madrid has got a better esophagus or proctologist or
actually
whatever.
America has a lot of the top. They may not always be the number one, but they fall into the top 10 in a lot of medical stuff here. We actually live in a great country to get medical health care and benefits. It just costs you an arm and a leg. And why a lot of people leave is because it costs you an arm and a leg. No one can afford the costs of the medical program here.
Right, which is why you need universal health care, so that way you could bring that get the privatized companies out of the mix. See, that's the problem. Look, here's the thing: people go into the hospital.
I even learned when looking at this stuff that you're saying they don't have privatized health care. They do. Everything I looked up here, a lot of the doctors aren't privatized, the hospitals aren't privatized, but pharma, insurance, medical, all the stuff that they still supply to these places are still by privatized companies.
Privatized companies who have essentially proven that whatever medications that they're providing is beneficial. And here's the thing: those pharmaceutical companies are not making trillions of dollars a year. You look at the United States and you look at...
No, but they're the same companies that serve us. They're just what they charge. What they charge the UK, they'll charge the UK for a package of pills for $10, and they charge United States $1,000. It's the same company, but they're charging different prices.
And why is that? Because we don't essentially say you cannot maximize profit on this medication. Europe does. They do not allow profits over health.
And I understand that. But why do we need universal health care to do that? Why can't we just literally standardize that this is not an okay? See, the biggest problem for America is that when you go in there and you go to a hospital and you get a bill at the end of the day, you're stuck with the bill. They can charge you whatever they want and then kick you out of the office, right? So why not still have the same controls? That's the whole thing. Like, why is the answer, we got to have universal health care? No, they have controls that state that they're not going to overcharge, or they're willing only to pay this much, that those privatized companies that sell to UK have to compete at those prices to sell their product. So again, they are competing because it is still branches. They don't pick the same company every single time. They get a contract. They get a contract with that company that may be for 5 years. And then next time that 5 years is up, they have to contract that medicine out again. So why can't we have the same controls without forcing everybody to go for universal? Why can't we have controls is kind of my point.
Well, the reason is because the American people are greedy. They need to fill their pockets with Benjamins, and they care about profit. Wait a minute. Let me finish.
Sorry.
They put profits over people, and that is a fact. And the fact behind that is you say, oh, when you go to the hospital, you get a bill. All right, let's say that I don't have insurance and I get a bill. Mm-hmm. Well, I guarantee you, in fact, I'm going to look up the stats and address it later on because I want the exact numbers. Okay. But the United States leads the world. I'm going to repeat that again. It leads the world in bankruptcies due to healthcare costs.
I'm not disagreeing with you with that, Mikey, but you're not listening to what I'm saying. Why do we need to force a whole system when we can add controls on the cost?
And I'm answering that. No, you can't control it because with privatized companies, what they're looking to do is get as much money as they can.
But the privatized companies are selling to these other countries. You're saying no, but I looked this stuff up. They're still selling. The same company, Trigon, sells the same thing to America as they do to the UK, but UK controls the cost. Why can't we?
Because, again, the pharmaceutical companies know they could bend the United States payer over and take advantage of them.
I'm making.
So we're saying
control that.
Well, because the answer to your question is because you have privatized companies. The United States,
not because they sell everywhere else.
You're speaking circles, TJ, and it works in other areas because those other areas say you cannot make X amount of money of profits off
That's the point. Is that you don't need a universal system to put those controls in, Mikey. You can still put those controls in today without the system. We do that all over the place. There's certain things that the banks have to. Are you shitting me, Mikey? There's certain things the banks have to follow certain rules and regulations. They can't just go
because
out
they're FDIC insured.
Yes,
because they're FDIC insured.
It's the same thing. There's the government itself has regulatory agencies out there that do mandate certain things from going crazy and out of control.
Well, I got to say
that's the point that
the evidence
I'm making, and that's all I'm saying is that why can't we? And that's all I'm throwing out there is why can't we just have controls?
The reason why is because you have lobbyists that essentially put money. You want to talk about corruption in the government? Here's where your corruption comes in. Johnson & Johnson pays off a senator. I wish I had this information right now.
He got to my point. He got to my point. I'm so happy. Look at Mikey's
No, I don't understand what you're saying, and you're goofing off when I'm being serious. When I'm telling you, if you're agreeing with me, then okay. So if you're agreeing with me, here's the evidence that universal health care works. Look at these other countries that I'm mentioning. Look at how many bankruptcies have come forth since these universal health care policies have come into place. Look how many more people are insured. Look how much healthier they are. They live a healthier lifestyle. They have less cancer. Why? Because they have better treatment.
No, you've even had this conversation with me. Is the stuff that is out there that is available to the American public that is poisonous?
That's another aspect.
Allow
That's
to
another
other
aspect.
Countries that stop that is again another side of these side effects.
That's another side.
But again, what I'm talking about and why I was clapping my hands and saying, which was my point, is what I've been trying to say is, again, with our government, to give them a certain amount of control where they have these lobbyists, where they are catering to these people, that were a lot of our issues, where you're like, well, I don't see the corruption. I was leading to that part of the conversation. You just nailed right into it, which is the fact of the matter is that they're getting money from these politicians that are making them and allowing these policies to continue. That's the problem in my eyes.
You're absolutely right. So you know how you get rid of that? You get rid of privatization. You get rid of privatization.
But you're giving it to the government, which is corrupt. Look for an example. Look for an example. And, you know, when you take, especially with a government today, if the government said you had to get a Subway sandwich, Jesus Christ, I watched too much Chris Porter. If the government told you had to go get a sandwich from Subway every single week, Subway wouldn't charge you $5 a sandwich. They will charge you as much. They'll look at the rate of how much they can charge you to make a profit and eye gouge you, and they'll charge you $30 a sandwich. Why? Because you have to buy one sandwich from them every single week, and that's how they're going to get you. So if you have a government that's going to then take away controls, how much money did the healthcare system and the pharmaceutical grow within Obamacare? They went up not 20%, not 10%. They went up 30, 40, 50% ever since after Obamacare. Why? Because of the lobbyists, the controls, and all the other stuff. So this is the problem of having a socialized
That was happening beforehand, though. You're talking about things that have happened since the beginning of government. Government's corrupt. So government's corrupt. Okay, we live with a corrupt government. We'll say that essentially every country can get their government to work for them, except for the United States.
Okay,
is that what we're pretty much saying?
No, because there's corrupt governments everywhere, and there's certain things on all their sides. But let's get back to the universal healthcare, since that's definitely you don't seem to want to talk about U.S. corruption and all that stuff. So let's talk about governments across the seas, right? So what is the cost for us to go to a socialized program? So what will cost America to hop onto the socialist train with government health?
I have no idea, but I would guess it's probably in the billions. I mean, that's just a pure guess.
Well, what would affect us as Americans? We would actually have to end up paying more taxes. And when I did the number here, right, most of these countries, right,
they pay higher taxes.
Pretty much between 45 and 65% average. Between 45 and 60% in these European countries that you're going to be taxed, right? 15 to 25% of that is for healthcare, right? So let's just say if you made $60,000 a year, 25%, you're looking at $300 a week. Pretty much what most of us is pretty much spending for healthcare right now. So that's not too big of a difference there, right? That's for standardized care. That is not for, and most of these countries, they don't cover your dental. Most of these countries will not cover your vision. This is just straight healthcare. Anything else is everything else is, part of it. Now there are programs out there where me and you were talking about, if you want better drugs, you want better healthcare, you want faster treatment, you have to pay into these programs. I couldn't figure out how much these programs cost, but obviously that's an additional cost off of the 25% tax that you're going to get for the healthcare program. Now to get the actual good healthcare, which people don't talk about, right? To get the good stuff, you're going to have to pay more, which I couldn't find the pricing system for that. But say you're stuck in the normal system, right? You still have very long wait times to see doctors, to see clinics. Why a lot of people leave out of the places, not only for better healthcare, but sometimes in their country to see a certain doctor for a certain ailment, it may be a year wait. It may be up to 2 years wait. They can't wait that long. If they have a sentence going, hey man, you should get this checked out, you need to see somebody here ASAP, and they find out the doctor that they have to see for that ailment has a 1.5 to 2 year wait behind it, they start venturing out and going seeing other doctors and other people. That's a normal fact that goes on here. So also one thing that I learned about it, just to talk about healthcare and all together, right? And chime in with the thumbs up when you want to stop me and stuff, which is also, they still have health insurance, I found out. A lot of these countries, right? So everyone's like, universal healthcare is going to help, it's going to help, it's going to help. But I found out you still have to have health insurance. Now, don't get me wrong. It's not as much as America because you're paying so much into the system, but you still have to have a health care. I have never heard that before. And that was very surprising to me, studying and looking this stuff up. And I want to ask you a little bit of how you're feeling. I want to get into more of what I want to talk about. But did you know that? Did you know that you have to still pay? Because they will cover a lot of your normal care, your medical care. But if you go see a specialist and that bill is a big bill, you do still get bills in these countries, and you still have to pay the difference, and there's still certain costs, and there's still all these things. Did you know, not that you're required, because you're not required, but did you know that you still have to purchase health insurance to cover the cost of specialized care?
So from what I understood is you have the option to get insurance through the company that you work with, or you can go ahead and go onto the universal healthcare system. And then that's just the bare minimum of exactly what you're talking about. The comes out of your taxes and whatnot. But if you're enrolled already with a insurance system, from what I've heard and from what I've read, that's it. You're done. You have your insurance just like we do through that company. But if I don't want that insurance, I could take the universal health care. And then if I want better programs, like you were saying, and I know about those programs as well, then you buy those supplements. And those long lines that you're talking about is not for people who have those supplements. Those are for the people who just stuck to the bare minimum for whatever reason. And
the money. I mean, look how much money is coming out of these guys' paycheck, right? You're getting taxed 65% of your pay. You don't have a lot left over.
Well, I can understand your view on that, but you also understand that their cost of living is a lot lower. So, like, for example, I had a fish dinner with a family of 10. Out here would have cost me about $300 or $400. Out there, I swear to you, it only cost me $125 between me and my family, and that was a fish dinner with wine. So I'm just putting in perspective.
No, that was actually an expensive meal, Mikey. I think it's actually cheaper than that. I think it's actually cheaper than that in Italy. I think it's actually cheaper than that.
Well, we had wine. We had like 3 bottles of wine. We had like 10 different fish. I mean, my point being is it's cheaper. Okay. It's cheaper living down there. Yes. Now, granted, they also make less, but the money that they get taken out for taxes. Look, anytime you have money taken out of your paycheck, it's going to hurt you no matter what. I'm not denying that, but it's something that I can say, maybe to word it, maybe not the best of ways, but they're so used to getting taxed that much that they don't have to buy that insurance unless they want the supplements, or they're going through the company. So to me, I'm an individual. This is just my opinion, and I know a lot of people disagree with me on this, but I'm an individual that if you want to take more of my money to better a school system, better a healthcare, better a system that I believe in, I sit here and I say, take my money, make it better. What do we have to do to make things better in this world for all of us? I don't pay. So people want to say, oh, I don't want to pay that much in taxes. I say, take it. That's my opinion, though. And I understand why people don't like that view. I get it.
No, but I think I actually want to agree with you on that, because I have the same feelings. My biggest thing, and this is talking about my government corruption, I won't get too much into it again, but it's like Chicago. Here's a perfect example. We have taxes that go into this. Remember, I've lived in Democrat. I think that's one of the reasons what gets me so frustrated and why I've kind of fell off the Democratic bandwagon, because I've lived in Democratic cities and I've seen the high taxes, the high everything here. And I was just in your boat. Take my money, better schools, better roads, better, education, better life, better all this stuff. And then you live here and you feel like, you feel like you're poor because all your money comes on taxes and your roads are broken, your school systems are broken. Everything here is highly taxed and you can't afford anything, and it's just really bad. And that's kind of my point, is that here in Chicago, we literally had 2 years ago, where we had to pass a law here that stated that government officials have to stop touching the money for the roads for other gains.
Well,
so think of that, right? The whole point for a road fund is to fix the roads, yet we had to make a law to keep them from touching the money.
There was something in Arizona that happened. I want to say, God, it had to be at least 10 years ago, where there was something that came on our ballot for that. And I jokingly, I like laughed. I'm like, wait, and I could swear, I think it was like the road tax too. First off, in Arizona, we have great roads. I mean, you know that. I mean, especially compared to like driving in New York or when I was in Chicago.
Right.
Unless you're on a toll road, the roads are terrible out there. But
it's
even at that, like I said,
but the toll roads are privatized.
Yeah, that I can never. That's a whole nother fucking issue. But it's funny because with well, now I lost my train of thought because we went on.
I gotta stop doing that to you.
But I mean, yeah,
we were talking about Arizona taxes and the roads.
Oh,
by the way.
So that's what I was saying. So with the
Kyle
taxes,
held up his sign.
Yeah, I got it. Yeah. My cue car holder just put it on. Thank you. We'll hold you on for another 6 weeks. So in Arizona, we had the same thing, and I like laughed with my dad. I go, "What the hell is this on the ballot?" I says, "Why do we have to tell them not to touch our roads?" And I don't remember what senator it was, but there was somebody that came in. I don't know who it was, but Arizona had all Republicans at this time. This was right around 2010. That they actually allowed people to dip into that fund for other. I don't remember what exactly they did it for. As far as I'm concerned,
won't tell you what they did it for, but they kept touching it.
But there was something that justified it that I had come across, and even that justification to me was not a justification because, like you said, and I agree with you, those roads, that money for the roads is supposed to be meant for the roads. That's supposed to be able to fix the roads, not anything else. So we had the same thing to come on our ballot that said you can't touch that money. So I'm sure somebody along the lines, who the heck knows, Democrat, Republican, whatever, turned around and said, "Oh, we need to allocate some funds here. Hey, there's no rulings that says that we can't move these funds. Let's move it." And now somebody caught on to it and says, "Oh, we got to stop that." Because I found if you want to say people are corrupt in government, I'll say where they are corrupt is the fact that most of them are former lawyers and they look for loopholes. And that, I
agree with you on that. Yes,
they look for all politicians, as far as I can see. Hey.
Sorry.
Yeah, darn his loopholes. I mean, darn his loopholes and helping the economy, getting back on track and getting people who were uninsured. Damn him. Damn him.
I'm so glad I got you to admit that. Can we have that on replay, Kyle? Thank you.
But no, I get what you're saying, and I agree with you. If there's funds, if there's taxes that are meant for a specific thing, that's all it should be used for. There should be none of this BS, but unfortunately, the former lawyers and some of these politicians just gets their girdle in a knot and got to play around.
So real quick, again, I know I've been definitely attacking the social policies, but I definitely want to tell you, before I can even get on board with more social policies and stuff like that, I need to see this stuff fixed. I just don't trust that aspect of our government and the stuff that's going on with it to make that portion better. Because we do, again, I think we live in a society today that we're very much, politicians, all these people need to just do their job and let us be. Well, over the past 20 years, we've kind of noticed, well, they've done a really shitty job. They've really paid out to these lobbyists, and they're really taking care of other people, and it's just causing more issues for us.
Well, I gotta say, we have a lot of good topics. We want to definitely continue this conversation. I don't want to cut things short here. Stay tuned. We're going to cut off here. But stay tuned for Sunday when we release part 2 of this episode. We'll be bringing in our guests in episode 3, or I should say part 3, and possibly maybe even have a part 4. We're going to see as we go along with this conversation. It's very big detailed, and there's a lot of questions and information to pass out there. So stay tuned for Sunday for part 2. But we will continue the conversation here just to give you guys some breathing room here before the next episode. So whenever you're watching, wherever you're watching from, thank you for watching in the middle. I bid you adieu.